set everything up correctly. Welcome, everyone. My name is Evelyn Mantilla from Access Health Connecticut. I am happy to welcome you to tonight's Healthy Chat. A couple of housekeeping items that I want to cover is that obviously we are starting now. We will be sharing information on screen during the webinar. On your computer, you can adjust your view options by clicking the small gray icon on the top right-hand side of your screen. On the Zoom app, you can switch screens or change your view by using your fingers to scroll back and forth. If you're having any issues with audio, feel free to dial by phone. You have the numbers here and the meeting ID as well, should you need to use that option. Again, I welcome you to tonight's Healthy Chat on behalf of Access Health Connecticut. And now I am happy to hand it over to my friend Brianna, who will begin the presentation. Thank you.
Welcome, everyone. Thank you for joining us tonight. My name is Brianna. I've been with Access Health Connecticut for about 1.5 years as a customer relations specialist working in the customer service department. You will notice that the chat has been disabled. This is because we handle private information. And if your question is more personal to your situation, we want to keep that confidential. During the presentation, we will work to give you an overall answer. If the question calls for a more detailed answer, we'll work with you to answer it. With that said, we ask that if you do have any questions during the presentation, that you send them to the email shown on the screen. And then for those of you who phoned in, the email is outreach@accesshealthct.com. We did get some questions sent in previously, so as we go along, we are going to try to answer those questions as well. So let's chat. Tonight, we have a few meeting goals we're looking to meet. We want to make sure that you get to know Access Health Connecticut. We want to make sure everyone understands the financial help that is offered to help make premiums low cost, and go over some coverages which may be free. Tonight, we want to make sure you are ready for the upcoming annual open enrollment period, so you feel empowered to choose the best insurance, or if you find that you have more questions, where to turn for help. Lastly, we want to make sure everyone learns how to use the coverage and benefits that they have chosen to get the maximum out of your plans. If we could go to the next slide. Again, we ask that any questions that may come to mind, you send to our email, outreach@accesshealthct.com. Before we get started, we do have a few poll questions we're going to ask to get a feel of who's joining. Are you an Access Health veteran? Are you just starting with us? And then we're just looking to see where everyone's joining from. The first question should appear on your screen. And that is, are you an Access Health customer? Okay, and we're just going to give everyone a few minutes to answer. Thank you. And it looks like majority, everyone's starting out. So we're going to move on to the next poll question. And it should appear on your screen momentarily. Is this your first Healthy Chat? Okay, awesome. I hope that if this is your first Healthy Chat, we cover everything you're looking to find out from us. If you find along the presentation you have a question, please don't hesitate to reach out using our email. So our last poll question is looking to see where everyone's joining from tonight. All right, and it's gonna say where you're joining from. It has the county, so if you just put your county in. Okay, thank you. So it does look like we have a lot of people joining from Fairfield County and also Hartford and New Haven County. It's great to see where everyone is joining us from tonight, and we're happy to have everyone here with us. And we're eager to help everyone the best way we can because we are here and we are here to help. Thank you for everyone who participated, so let's jump in. Some of you may be asking, what is Access Health? We were established by state law in 2011 in order to meet the requirements of the Federal Affordable Care Act, or the ACA. We are here so you can shop, compare, and enroll in quality health insurance plans from brand name insurance companies. And I think the most important point on this slide is that we are the only place where you can get financial help to lower your cost or be eligible for free or low cost coverage through Husky Health. And you'll see that Husky is also referred to as Medicaid or Children's Health Insurance Program, or as we call it, CHIP. If we can move to the next slide. So what is the marketplace? The marketplace is where individuals come to get health insurance. We work with individual health plans offered by Anthem and Connecticut. We work with individual dental plans, which are offered by Anthem. We also work with the small business field to assist employers in offering health and dental plans. Just a side note, you are considered a small business with 50 employees or less. We work with Husky Health. When you're enrolling with the application that you fill out, it's built to assess your eligibility in which you're eligible for either Husky or an individual health plan with or without assistance. And then in regards to small business and Husky coverage, you are able to enroll in the coverage anytime throughout the year. Husky works off of monthly income, which allows you to enroll at any time. And then also on a very important note, we want everyone to be aware that when shopping with health coverage, when shopping for healthcare coverage, please make sure you understand that what the products are and how they work. All of the health insurance plans that are sold through Access Health Connecticut are ACA or Affordable Care Act compliant plans that are approved and regulated by the Connecticut Insurance Department. These plans include required consumer protections under the state and federal law. If you're looking for plans outside of the marketplace, such as healthcare sharing ministries products and discount or risk sharing plans, they're not ACA compliant plans, and they also are either not health insurance plans or they're unauthorized insurance products. If you do have any questions about a product, you can always contact the Connecticut Insurance Department at 860-297-3900, or you can always email them at insurance@ct.gov. We just want everyone to be aware when going through this process to make sure you have done your research and due diligence with what you're committing to on and off the exchange or the marketplace. So let's talk about our mission. Our mission at Access Health Connecticut is to increase the number of insured residents, improve healthcare quality, lower costs, and reduce health disparities. And then now we just have a small video to share with you.
You can shop, compare, and enroll in affordable healthcare plans from insurance companies you know. We're in a mission to increase the number of insured residents in Connecticut, and 90% of people qualify for financial help or are eligible for low-cost or free coverage. Healthcare coverage is more important than ever, and we're here to help. Visit accesshealthct.com to learn about your options.
So important dates to make note of are the open enrollment dates. 2021 open enrollment starts November 1st to December 15th. Next slide.
Brianna, we want to send another reminder about the email to send us questions.
Yep. So as a reminder to everybody, if you have any questions, remember, reach out to us at outreach@accesshealthct.com. Okay. So if you are new and starting an application for the first time, this is an important slide for you. If you're returning, it's still an important slide, but if you have an existing application, we may already have some of the information, but always double check to make sure all of your information is right in your applications. So what do you need to complete an application? You're going to need dates of birth and social security numbers for everyone who will be on the application. You'll need citizenship and immigration documents like a visa, permanent resident cards or green cards, naturalization certificates, anything that's going to prove residency. Next, you're going to need your most recent W-2 and the Form 1040 or the Form 1099. In the application, you're asked about income twice. We ask for a projected income for the upcoming year. Because there's a possibility that you may be eligible for assistance, it's important to give your best guesstimate. And then we'll go more in depth about income in the upcoming slides. We also need any current insurance coverage that you or anyone in your household may be enrolled in. And lastly, on the checklist, we ask that you have accessible to you pay stubs, profit and loss statements, or other employment information to confirm income for everyone in the household. This information is going to be helpful when you're asked for a more detailed projection of your current income. So let's move on to the next slide. We are moving on to talk about understanding financial help. In a previous slide, we stated that on the marketplace, we are the only place that you can get assistance with paying premiums. The financial help comes from the advanced premium tax credits, or as we call them, APTCs, and cost sharing reductions, or a CSR. The advanced premium tax credits reduce your monthly insurance bill or premium and is paid directly to the insurance company. Cost sharing reductions reduce the cost of your out-of-pocket expenses like deductibles and co-payments and is paid directly to your healthcare provider or the pharmacy. In order to use cost sharing reductions, you would need to enroll in a silver plan. Being eligible for CSRs will ultimately be based on your annual income. Another way to think of the subsidy or the financial assistance that Access Health offers is an APTC is like a coupon applied to reduce the monthly payments you will be making to keep your coverage active. Most customers choose to receive the tax credits each month to reduce the premium payment paid directly to the insurance company, but there is another option where you can elect to receive all your tax credits when you file your taxes each year, or to only take part of the tax credits that you are actually eligible for. If you're unsure about what your expected income is, it is an option you could consider. As we move through the presentation, you'll see why it could be a better option to consider depending on your situation. Next slide. So how do you qualify for financial help? Here is a chart to give you an idea of what type of financial help you could qualify for. It is based off your annual and monthly income, which is why we ask that you project your income as closely as you can when it comes time to fill out your application. In this slide, it shows the income levels for a household of 1 and a household of 4. So if the household of 1 makes $17,608 or under, it is possible that they'll qualify for Medicaid or Husky, depending on if you meet the other criteria necessary, for example, monthly income or citizenship and immigration status. If the household of 1 makes $51,040 or under, you could qualify for financial help in the form of APTC or CSR. So a household of 4, in order for them to possibly qualify for Medicaid, would need to be under an income of $36,156. Again, that's also going to depend on the monthly income and citizenship and immigration status. In order to qualify for an APTC or CSR, the family of 4 needs to make under $104,800 annually. Just know your monthly household modified adjusted gross income, which is the figure that we use to determine eligibility, also known as MAGI, determines whether you're going to qualify for Medicaid. We can move to the next slide. So an important question that we ask is, Are you offered coverage by your employer? And here's why. If you're offered healthcare coverage through your employer that is considered affordable, you're not eligible to purchase a plan with financial help, regardless of your household income. However, if you are offered healthcare coverage through your employer that's considered unaffordable, you may be able to purchase a plan with financial help if you meet the household income requirements. The one thing you don't want to be is getting assistance with paying the premiums while being offered or enrolled in affordable health coverage with your employer. If that happens, you will most likely be paying back all the tax credits collected while the employer coverage was available to you. The system determines the affordability through the information that you provide in the application. Affordability is also determined by the lowest cost plan for an individual and not a family plan. So just make sure to contact your HR department and have all the information required, as if you don't enter enough information regarding the employer-sponsored coverage that's offered, it will disqualify you for a PTC until all of the necessary information is provided and you do indeed qualify. If you're looking to figure out the affordability on your own, you can always visit irs.gov or find a certified broker to help you understand your options. We did have a question previously before the meeting in regards to what plans the consumer qualifies for, since the employer-sponsored coverage is getting too expensive. What I would say is that before completing an application to see your options, I would confirm that the coverage that you're currently enrolled in with your employer is not deemed affordable, coverage is not deemed affordable, because if it is affordable, this may not be the best choice for you, as you'll not be eligible for any assistance with us. So it's just something that you would need to look into. Next slide. Why does MAGI, or the Modified Adjusted Gross Income, matter? MAGI is used to determine eligibility for financial help and other qualified programs. The amount of MAGI is used to determine eligibility for financial help and other qualified programs. So the amount of financial help you receive is dependent on your MAGI. If your income changes, it's important to update your account as soon as possible. This is because whenever it changes, at the end of the year, you're going to need to reconcile the tax credits you receive on your taxes. If you underreport your income, you may owe money back or owe back tax credits that you weren't actually eligible to receive in the first place. We understand that income is tricky. If you have trouble with what you should report, contact a tax professional. They can help you determine what your modified adjusted gross income will be. The most important part of this slide is that you are updating your income as soon as possible if it does change. Income can be updated anytime throughout the year. Can we go to the next slide? So MAGI is based on your expected household income for the year that you want coverage, not last year's income. The income should be counted for you, your spouse, and everyone that you'll claim as a tax dependent on your federal tax return. Include their income even if they don't need the health coverage. What you're going to do is basically take your adjusted gross income, or your AGI, and add in your non-taxable Social Security benefits, any tax-exempt interest, as well as any excluded foreign income. That will equal your modified adjusted gross income. There is a worksheet online with a complete list of what is used to calculate. We just want you to know that child support paid or received is not considered part of MAGI income. And also, as of January 1st, 2019, alimony is no longer considered an income for the receiver or a deduction for the payer. This is for divorces finalized after January 1st of 2019 or amended after January 1st, 2019 to include this. There are some customers who will have more difficulty calculating their MAGI, such as those who are self-employed or have seasonal work, or are sole proprietors. If you need help projecting your income for the year, please seek advice from a tax accountant or a tax advisor. Next slide, please. So this next slide, due to the public health emergency, the CARES Act was passed for the individuals who received additional unemployment and stimulus. Some of the income does need to be reported. The chart here shows that the IRS stimulus check should be excluded from both your monthly and your annual income. The CARES Act additional unemployment should be excluded from your monthly income calculation, but it does need to be added into your annual income. And then all traditional unemployment that you're receiving should be included in both monthly and annual reported income. If you have any questions about the federal pandemic unemployment compensation, you can refer to the link provided below. If you phoned in, that link is www.ctdol.state.ct.us/Fed Unemployment INS Programs.pdf. And then next slide. So the question here is, why is it important to update my information? It's important to update your information because at the end of the year, some people will receive a 1095-A, where you're required to reconcile any financial help you received. In order for you to continue to be eligible for financial help, you need to reconcile. What does reconcile mean? It means comparing the amount of premium tax credit you used with the amount of premium tax credit you qualify for based on your final income that you would get off of your taxes. So there is no tax penalty for not having coverage in 2020. However, if you received financial help in the form of tax credits, it is still required to reconcile tax credits used to help reduce your monthly health insurance premiums. When you file your federal tax return. So in order to reduce any liabilities with IRS at tax time, make sure your income is reported accurately in your application. You could most likely be penalized if you receive too much tax credits due to underreporting your income. But it also works the other way. Individuals who over-project their income can receive a refund after filing the Form 8962. Basically, you pay any difference or you get it as a credit. So when you pay your federal income taxes for the coverage year based off the income reported in the application. Let's take a moment to watch a short video.
Access Health Connecticut. Healthier people, healthier communities. It's very important that you keep your Access Health Connecticut account up to date. Tell us if there are any changes to your income, address, or household information. If you don't, you might miss important news from us, and you could run into issues when you file your federal income tax return. Speaking of filing taxes, the IRS will make sure its information matches the income information you gave us when you applied for healthcare coverage. Before you file your taxes, we'll send you a 1095-A form, which will show the tax credits the government paid to your insurance company to help lower your monthly costs. If your filing information is different than when you applied for healthcare coverage, you may have to pay back some or all of the tax credits you received. That's why it's important to tell us about any changes and to file your taxes properly. For more information, visit learn.accesshealthct.com/taxinfo.
As a reminder, if you have any questions, please reach out to us at outreach@accesshealthct.com. I know we just covered a lot of material on financial assistance, and that may have brought to mind some questions, so reach out so that we can get those answered. At this time, I want to switch the presentation over to my colleague, Saluku, who will go over how our system works and where to get the help you need, as well as how to look at the plans offered by Access Health and the terminology associated with those plans.
Thank you, Bree, and Thank you everyone for joining us today for this Healthy Chat. As stated before, my name is Saluku and I work for the Access Health Connecticut Customer Resolution Team. And we'll first be starting with the Comparing Health Plans section. So starting with this, you would want to start by going to our website at accesshealthct.com. Here you can see if you qualify for any financial help and browse the plans anonymously, as well as you can take into account your doctors, prescription drugs, and medical services to find the right one for you. Next slide, please. Oh, I'm sorry. On this slide, there's also a short video that we'll be watching.
Thank you.
Access Health Connecticut. Healthier people, healthier communities. When choosing an insurance plan through Access Health Connecticut, it's important to shop and compare your options. Meet John. During open enrollment, he chose a plan with the lowest monthly payment he could find for $100 a month. That's $1,200 per year. Later, he learned this plan did not cover the $150 a month prescription drug he has been taking. That's an additional $1,800 he'll have to pay out of pocket, which is a total of $3,000 a year. What now? Can he avoid the additional cost of the prescription? He might. By comparing his options, he could pick a different plan that includes coverage for his doctors, prescription drugs, and other services. He might even see cost savings. To compare plans, visit accesshealthct.com and click on Compare Plans, or talk to a broker, or visit an enrollment center and fairs around the state. Access Health Connecticut. Healthier people, healthier communities.
Thank you. And then the next portion of this, to start with, you would always want to keep in mind that when selecting a plan, you would want to always remember what your total cost estimate should be for the plan that you're going to be selecting. That's going to be made up of 3 separate parts. The first part being your monthly premiums, which is your monthly premium payment that you'll be making to the carrier in order to remain enrolled in your plan. You could also account for the fact that based on the amount of tax credits you receive, that's going to reduce what your monthly premium payment is. The second part would also be keeping in account your yearly deductible, which is the amount you pay each year before the plan would pay anything for you. And then the third part could also be your co-payments and your co-insurance. These would be the charges each time you visit a doctor, get care, or buy a prescription drug. These are normally a set dollar amount or a percentage. And then all 3, as stated before, would be used to get your total estimate cost based on the answers that you provided for each section. So the first part that would come out is going to be asking you for your total household income. This is where you can get an idea of the different plan options available to you and a snapshot of what your premium will look like. Basically, you're going to be inputting your information. There are also some optional fields. However, when it comes to providing your information, more is better, as it would get you a closer estimate of the plans that are going to be available to you and that would suit your needs best. In this one, you could see it does say the total household income. You could report that as a different amount, whether it's annually or monthly, but annually is normally the best. Next slide. And on this side, this is where you'll be going over the additional household members. Again, providing as much information as possible is good. And you see that it does also ask for the age of the members and how they're related to you. You will also notice on the screen that based on that, additional information is being asked because the application does take into account, for example, pregnancies. We would ask if a member is pregnant for determination of the Husky A pregnancy coverage, or if you could even get a special enrollment based on being pregnant. Next slide. And on this screen, this is where you would put in how often you use your coverage. This is just to help you get a good idea of making sure that the plan that you're going to select is going to be the best one for you. Previously, we have received a couple questions about sensitive information regarding what is covered or what doctors accept the Access Health coverage. On the slides before and these next few slides, we're going to show you how you're entering in that information and searching to make sure that the plan you select is the best one for you. Next slide. On this section, as stated before, this is where you would make sure to search if your doctor is in network for the plan you will be selecting. You have a few different information options. You'd put in the doctor's name, how close they are, of what zip code, and then that will zero it in. And you could select that you would want to check for whichever plans are going to be shown to you in your eligibility determination, or the shopping screen, which doctor would be in network for your plan, or if they are in network for your plans. Next screen. And on this screen, you could search for specific prescription medications and how frequently you would be using those medical services. I do believe that you can only search for 5 at a time on this. So you would just also want to keep that in mind and make sure you could also see further into the plan details if those prescriptions would be accepted under the plans you see as well. Next slide. And this would just be a quick snapshot of what your estimated premium and the primary care visit costs are. You could also further review the plan detail documents for more in-depth information on the plans. Also, you could see here specifically for the primary care visits spaced between the 2 different plans. One primary care visit is only 10% and the other one would be a set rate of $40. So that's another thing to keep in account. And also you can see here that both plans would accept Dr. Aaron Coopersmith. However, neither of them have the prescription covered. So that's just to give you an idea of things to look at for the plans. Next slide. So going forward, I'm now going to start going over the types of plans that we offer. So we're going to start with speaking of the gold plan. On the previous 2 screens, if you did notice the different rates that it showed, one plan was a bronze plan, one was a silver plan. So starting with the gold plans, these plans usually have the higher monthly premiums but lower costs. These plans may be best for people who frequently use the services or who want to guarantee that if they ever do need care, they won't have a higher out-of-pocket expense. Next, we would have the silver plans. These usually have moderate monthly premiums and moderate costs when you would need the care. These ones may be best for people who only use the services from time to time, or the people who would qualify for the cost sharing reduction plans, as cost sharing reduction is only applied towards the silver tier level of plans. And next, we would have the bronze level plans. These ones would usually have the lowest monthly premiums, but higher costs when you actually go get care. These may be best for people who don't think that they would really need to use their coverage, but do just want the safety net of health insurance, or essentially just to be protected against the high cost of any serious health events. And lastly, we had also previously received questions asking for more information about the options of the catastrophic type coverage in Connecticut. If you'd be looking for a more detailed explanation or specifics of the catastrophic plans offered, I would recommend that you speak with a broker. What we have here now is that there are some restrictions placed to qualify for a catastrophic plan, such as it's only available to people under the age of 30 or those who receive a hardship or affordability exemption. And under a catastrophic plan, you wouldn't be eligible for any financial help. These plans normally have the lowest monthly premiums, but they would only protect you but they would only protect you once your healthcare costs reach or near the annual cap of your out-of-pocket healthcare spending. Next slide. And then some more important terms regarding the health insurance process is just always keep in mind what your premium will be, which is going to be the monthly premium or the monthly payments that you make in order to remain enrolled in your coverage. There's also the provider network, which is essentially the list of doctors or other healthcare providers and hospitals that a health insurance company has contracted with to provide medical care to its members. The in-network providers usually means you would have the lower out-of-pocket costs. Next is a deductible, which is going to be the amount you pay for your covered healthcare services before your health insurance plan would start to assist you with making payments. And then lastly, we also have the annual out-of-pocket limit, which is going to be the most you have to pay during a calendar year in deductibles, copays, and coinsurance for your covered care. Next slide, please. And with that, I do also want to remind everyone that if you do have any further questions as we do continue going forward, you can contact us at outreach@accesshealthct.com. So now I'm going to start going over the benefits of your coverage. So first, what are the essential health benefits? All plans offered through Access Health Connecticut must cover these 10 benefits as is required by the Affordable Care Act. The first would be prescription drugs, then preventative services, outpatient care, lab tests, pediatric services, trips to the emergency room, treatment in the hospital, care before and after your baby is born, mental health and substance use disorder services, services and devices to help you recover if you are injured, have a disability, or a chronic condition. Also, the yearly in-network preventative visits are important to maintaining your health, and all the health plans offered through Access Health Connecticut would cover those for you. Next slide. So this shown on the screen right now is going to be the main page of the Access Health website. This is where you can shop, compare, and enroll and search for specific topics or find the helpful information for you. If you already have an account through our website, make sure to click sign in and not enroll now. So your enrollment will be done through your current application and you won't be creating a new one. It is important to make sure that your account is up to date whenever there is a change in circumstance, as this can affect your eligibility or financial help that you would currently be receiving. And if you do have any trouble logging into your account, you can feel free to contact our call center if you need assistance with resetting your password or even just remembering what your login user ID name will be. Next slide. And some of the buttons that you can see on our website as well would be some of the ones shown on the screen here, starting with a small business tab, which would direct you to our small business site. There's also a dental section. This would bring you to a separate dental portal to purchase dental coverage through Access Health Connecticut. As I said, it is a separate account, so you would also need to create a new login ID and password when looking for your dental coverage. There's also a financial help button, as well as a learn about our plans tabs. This would direct you to our learn more section, where there is a lot of tips and information to help you get through that. And then there's also the Medicaid or Children's Health tab, which would direct you to the Husky Health members website. Next slide. And again, it's important to remember that we are here to help. Again, before we had started the presentation, we were receiving a lot of questions about plans and how to get assistance with that. So while going over these next two slides, I'll also tell you what options will be available to this year to get help. Next slide. So here, this is where you can see that we do have options for a live chat, or you can find our enrollment centers or navigations or even enrollment help, which is where you would be trying to reach out to find a broker, a CAC, or a certified application counselor, and then our navigators as well. You could also contact us by email. And I did also want to put in that for the live chat, we would be answering questions based on your account, but you cannot complete an enrollment there. And then we also have the popular topics or the frequently asked questions. And then from there, you could always get further information regarding all that. Next slide. So of course, you would always be able to contact us by phone. That would be reaching in or contacting us at 1-855-805-4325, which is going to be our call center number. The regular hours are from Monday to Friday, 8 a.m. to 4 p.m. However, during open enrollment, they will have changed hours. Generally, it's going to be 8 a.m. to 8 p.m. Monday through Friday, and then on Saturdays, 9 a.m. to 3 p.m. Next slide. And we do also have certified enrollers to help you go through it. We have 150 plus certified application counselors to assist you through the application process and make sure you be reporting your information as accurately as possible if you are having some trouble going through that. As well as we have over 250 certified brokers who could recommend a plan that would work best for you and your family. The brokers are able to explain to you in more detail and talk to you about your plan details, as well as confirming what medications are covered by your plan, or if your doctor would even accept that plan as well, or if they're in network for it. Next slide. And then another form of assistance we offer will be our navigators. Our navigators will be offering in-person support for you year-round. They could be located at the Community Renewal Team, 330 Market Street in Hartford. And their website would be crtct.org, as well as at Project Access in New Haven and 63 York Street. And their website would be pa-nh.org. Next slide. And lastly, you could always reach out to us and follow and share along at Access Health CT for Facebook, Twitter, YouTube, and Instagram. And with this, I do also want to mention that our call center will be open on the first day of open enrollment, which is a Sunday, Sunday, November 1st, and they'll be open from 9 a.m. to 3 p.m. So with that, this will just about be the end of our message. So I did want to have 3 more poll questions for you. These ones will be posted all at the same time. We would just like to know if before today's presentation, how familiar were you with Access Health Connecticut? And before today's presentation, how familiar with you with our enrollment process? And lastly, after completing this, how satisfied are you with the information presented to you today? Okay, and it's just about time to close out the polls. So with that, we do want to say thank you guys for taking part of our healthy chat today to you. And I hope we were able to help you feel more comfortable about going through this year's open enrollment process or even understanding more about it. And if you do still have some questions, we will have more healthy chats coming up, as well as you could always feel free to contact us in any ways mentioned before, whether you want to go on our website or even contact our call center for further assistance. And again, I want to say thank you all for joining.
Thank you, Suluku. Thank you for everyone. Have a great night.
Goodbye, everyone.